Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are going to conduct a speaking session and solid sentences we are going to learn, and with this is something called groundwork, preparation for the future. Get ready with your pens and papers. Yes, we have 6 students on board. Okay, I'm going to give you wonderful sentences, extraordinary sentences under extraordinary cases. These are not ordinary ones. Remember, the things which I'm going to tell you now are not ordinary ones. Yes. So, we are going to learn the sentences, quality sentences. Yes. Right. Now, hello, dear friends, students, and OET aspirants. We are here today to master extraordinary sentences. Now, what are these extraordinary sentences? Yeah. So, extraordinary sentences are those sentences beyond ordinary. Now, let us categorize sentences into 2 different kinds. One is the ordinary set of sentences, and the second one is the extraordinary set of sentences. Now, you want to get a B grade or B plus or an A grade. So A grade, B plus or B grade. These are extraordinary grades. Or you would like to want, nobody wants, but C plus, C, and even below that. Now, what do you prefer? Is the talk of the town. Now, in OET, there is a thin line which is bifurcating the scores into pass or fail. There is nothing called pass or fail, but desired scores or less than desired scores. There's a margin, there's a line. So the line is already drawn, and the line is 350. 350. Those who get a 350 and plus That means they are successful in achieving the desired scores. Now, what are you supposed to do? If you want to enhance your quality, you have to learn some sentences. I'm going to give you those sentences. I'm going to give you those. I have some collections and I want to transform them, and I'll give you those sentences. All right. Yeah. Number one. Number one is, say, for example, say, reassurance. 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 Many people, they don't understand what is reassurance in the first place. So if the question paper asks you, give reassurance, they'll say, I reassure you. Is this what the question paper is asking? Or the role play card is asking? What exactly is the role play card asking? So here, reassurance. The patient is in panic, tensed, worried, and upset. Now, under these conditions, whatever you tell, the patient is not ready to listen to you. In that case, what are you going to do? Many people I have seen, their role plays. They say, I reassure you. You need not worry. The patient is already worrying, and you are saying, you need not worry, I reassure you. He's already worrying. How can the patients be reassured? Reassurance means what? Okay. Now, we are going to learn how to improve the quality of our sentences. Now, I'll give you YouTube. Yeah, I have already started. Thank you. So, now what do you mean by reassurance? Number one, point number one. All of you note down these points, and afterwards your notes, put it in send it to me so that I'll put it in the group. And all our students, I'll give you permission to post your material in the Telegram channel. Till now, I did not give anybody because many people are coming and saying leaked papers, that papers, this papers and all. So ours is a platform where it is very neat. Okay. So strictly maintained. Right. Now, what is this reassurance? Now, my father is going for tri-weekly dialysis program. Tri-weekly dialysis program. In that case, the son is talking to the nurse. I'm worried about my father. Will this procedure be painful? Can my father tolerate? Are there any side effects? What are the consequences? In case my father doesn't want to, then what may be the problems? Why should my father accept your proposal of tri-weekly dialysis program? What gives? What is the benefit? Why this program in the first place? He has a bunch of questions, a bundle of questions. Yeah, he's right in his own way. You know what is a dialysis program? You know everything because you are a medical professional. What about a layman, an ordinary man? How is he going to handle this situation? He knows not anything about this procedure. I'm sorry, nurse. I heard that you're going to do this dialysis for my father. I have basically no prior knowledge regarding this so-called dialysis program. Can you please explain me? And you'll be asking question after question, question after question. He has the right to know, because the person who is undergoing this procedure is his dear father. He's concerned about the safety. Now, this sentence which I have told you, you can use in your speaking session. Your concern regarding your father is commendable, is appreciated, is absolutely reasonable. You have the right to have the complete knowledge regarding the procedure prior to the time, scheduled time, well in advance. So this is the way how you can speak to them. Now, how are you going to write down the word? It is reassurance. Now, what does reassurance mean? What does reassurance mean? Reassurance means cooling down. Cooling down. Your words are not important, the deeds are more important. The cause is not important, the effect is more important. What effect your words are going to have on the patient or the caregiver is of absolute importance, utmost importance. Every word counts. Sentence after sentence. You have to harp on the same string. It should reverberate on his mind. Slowly, 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 you have to bring him into your way. You have to treat him as a child who does not know anything. But you should treat him as an adult who can understand everything. A child who does not know anything, but an adult, a mature person who can understand everything when explained. He knows nothing, but he can understand everything when it is explained in a crystal clear manner. The impact is more important. The means and the ends, the process and the goals, or aims and object. This reassurance is an objective. It is a goal. It's a target. So you have to see the target language. Whatever you say, is it going to materialize or not? Is the patient reassured? Is the patient comforted? Are all the doubts cleared? Is the anxiety wiped off entirely? Is the panic erased totally? There should not be even a bit of doubt on the part of the patient or the caregiver. Once you complete reassurance, that impact should be on his face. Yes, nurse, I'm totally relieved. I now understand what exactly you are trying to convey. Based on the information you are given, I am going to consent, either oral or written. I'm ready for that. He should smilingly pass this message to you. That means the patient is reassured. Many students say like this, do not worry, I'm reassuring you. What do you mean by reassurance? Now I'm going to give you the word. Now reassurance means yeah, here we go. Now what is reassurance? Let's ask our dear darling father, Cambridge Dictionary. Reassurance. It is a C2 vocabulary. You will not even know the meaning of what is reassurance, and you'll say, I reassure you. Reassurance means words of advice, words of comfort. The intention is to make someone feel less worried, minimizing the anxiety as far as possible. It's a C2 vocabulary. Number of students, maybe 99 out of 1,000, do not know the actual meaning of this word. Reassurance. It's a very great word. It doesn't mean that you have to say, I reassure you. That means you are doing this in deeds or in words. I reassure you are just words. Now, what is the deeds? First thing is, accept what he is telling. I am worried about this dialysis. My father is 71 years old. Will he able to tolerate if there is any pain? Being a son, you are worried about your father because you love him so much. Started reassurance. I absolutely understand your concerns. They are completely reasonable and valid. I agree with you 100%. If I were in your place, I would have also felt in the same way. It's quite common in such situations. Any individual would react in this same way, and there is nothing abnormal about these reactions. As a medical professional, I know what it is exactly. Because you do not know anything about this, you are anxious. According to my knowledge as a nurse or a doctor, and based on the practical experience of solid 20 years as a nurse or a doctor, I'll give you another angle to this problem. Many individuals face similar conditions, and in these cases, we offer offer dialysis program. Because they undergo tri-weekly dialysis program, the cleaning of the blood, the cleaning, yes, is a cleansing program. Now there are two things. There are two options here. Either you can accept or you can reject. Now, if you reject, there are some complications. If you accept, there may be some complications. But choose the better of the two devils. There are two difficulties. One is, if you don't take, if you do not accept, then you'll face some problem. And if you accept, there may be some problem. Now choose the better option. Undergoing dialysis far outweigh the disadvantages. The advantages of dialysis program far outweigh the disadvantages. Now, if you do not take this dialysis, undergo this dialysis program. If you do not accept, then what happens? The impurities in the human body get accumulated. And you are prone to complications, severe complications. So in order to avoid these severe complications, you can opt for a dialysis. Of course, there are very few, you can count them on hand, minor side effects. Maybe pain, but this is better. No? A little pain is better than suffer severe complications. Many patients, many individuals who are undergoing dialysis program are leading a normal life. The only exception is they are coming to the hospital 3 times a week and undergoing this procedure. There is not much difference, and this is the only thing that you have to do. Now, the advantages are the complications of severe impact. They are nullified. See, all these sentences which I am telling you, how much you can speak, but you take some sentences and use. Suggestions are mine. Decision is yours. You are the son of Mr. Lincoln. You are the only person who can make your father convinced. Convinced with your love and affection. And your father trusts you. So now it is your responsibility. And make him agree for this. I strongly believe that I have given all the information regarding the importance of dialysis program. How does that sound? You're amazing, nurse. You have clarified everything. You are a very excellent nurse. I now understand what exactly you want to convey me by explaining all the pros and cons. You have done your role well. Now I shoulder this responsibility and will definitely convince my father and make him understand and give his consent. Thank you very much, nurse, for explaining me in such a detailed manner. So what all sentences I am telling you, you can also use. Thank you, Mr. Lincoln, for giving a detailed explanation of the pain you are feeling at the moment. The explanation regarding the condition you are facing at the moment. The same sentences you can modify and point it at an angle. All these sentences you can use in your speaking session. Reassurance means words of advice. That means you are advising him. You're not ordering him. You're not commanding him. You're advising him. That means you're giving suggestions. I can only give you the suggestions. But it is you to decide. Suggestions are mine, but decisions are yours. You have every right to accept or reject the proposal of dialysis program. But it is my duty to explain everything in detail and make you understand. So this is the way how you can speak. This is called reassurance. When every person who is undergoing dialysis or leading happy lives, the only exception is they are coming to the hospital for a tri-weekly dialysis, 3 times a week for this dialysis program. Other than that, everything is normal. So if that is the case for everyone, why not you? The lifespan can be extended. So this is the way how you have to. Then how the patient will feel. He will be looking at you with admiration, appreciation. Okay. From these, can't you take some sentences and use them? Yes. Many people don't have time. Forget about them. We are least bothered. We are least bothered about every Tom, Dick, and Harry. They don't have time. They don't have time. But if you learn these things, you go to the YouTube and write in each and every sentence and you use them. Yes. Right. And words of comfort. Intended. The intention is not to pass on the information. The intention is to check the impact. The goal is making him feel less worried. Don't you worry. Things are going to be normal. The only thing is, come here 3 times a week for a dialysis program. Other than that, everything will be normal. So that is what is reassurance. Now I'm going to give you the sentences. You can note them down. Yeah. Right. Note down all these sentences which I'm going to give you now. Yeah. Now let us take this one. Sentence number 1. Rest assured, comma, this is quite a common procedure. Full stop. It is nothing to be alarmed about. Rest assured means relax. Rest assured, everything is okay. Rest assured, assurance. Everything is fine. Everything is under control. All the complications will be taken care of. So that is what is rest assured. Forget about everything else. Because with this, you can just relax. There is no problem regarding this procedure. It is nothing to be alarmed about. Let me reassure you that eczema is self-limited. Period. I'm giving you sentences. Note them down. Do not worry. Period. If you can follow my advice, comma, you will get much better soon. Period. There is nothing to worry about this condition. There is nothing to worry about this condition. Period. It will go away all by itself in a few days with some rest. Period. I know that it sounds difficult at first, comma, delete that. That it sounds difficult at first, comma, but with practice, comma, I am sure you will be able to manage. Period. I am quite confident that you won't have any more trouble. The staff here are very experienced. And will take good care of you. So you can improvise the quality of these sentences. The staff here are very experienced and will take a good care of you. Your health and welfare is our fundamental responsibility, comma, and therefore, comma, hospital staff will implement all the necessary measures for your safety. Period. To see the quality sentences here. So now you can write your own sentences. Regarding today, we are taking reassurance as the topic. How this is called reassurance. This is called reassurance. Okay. Your general physician knows everything about your condition. After analyzing all the pros and cons, he has come to a conclusion that self-injecting insulin is the one and only option for managing your condition. All the other options are ruled out because they are not going to help you anymore. If you are compliant with the suggestions, you can manage your condition and lead a normal life like any other normal individual. The only difference is you're taking insulin injections on a daily basis. Right. See how you are able to talk each and everything. Every role play, there may be some reassurance. There may be some reassurance. So first you have to talk using facts and figures. Facts and figures. Only when you tell the truth, background situations, and you should relate yourself with the patient, and you should make him convinced, then only he will listen to you. So this is the way how you can do reassurance. Reassurance. This is what is reassurance. So take these sentences, write them in your own style, and then implement that. So this is regarding insulin injections. You are not going to get a donor for kidney transplant. I know that I am going to die. I am worried and anxious. I want my family to be with me when I am dying. And I don't want any rescue. I want to die peacefully. Now, how are you going to reassure that patient? So providing reassurance is not just words. Providing reassurance are deeds. You should make the person feel. You should make the person trust you. You should make the person realize that this is not a serious problem. You should make the person understand that this is the only alternative. You should make him understand that you are knowledgeable and you are giving the right information. You should make him say yes to your suggestions. It is in your hands. Reassurance means you are hypnotizing the patient. You are making the patient convince. You are making the patient realize and ultimately say, yes, I agree with you, nurse. Before I was reluctant because I did not know anything and I was only worried. I was scared. But now after your information, after your explanation, I have understood what exactly my condition is and what the solution is, and that you are suggesting me good things, and that it is my right to take the decision. I understand that I have to select the option wisely and not just blindly reject something. So After listening to all your explanation, my answer is a yes. I go with you. Let my father have tri-weekly dialysis program. I will definitely take the insulin injections on a regular basis. I'm now eager to listen to you, nurse. Tell me everything about that. I don't want to miss anything. All the important information, kindly tell me. Provide me. This is the way how you have to follow. This is the way how you have to speak. I strongly believe that I have provided all the relevant information necessary for you so that you can decide what course of action you want us to take and give us the approval or consent for going ahead. Suggestions are ours, but decision is yours. How does that sound? Or what is your final opinion? So this is the way how you are dealing with the patients. The patients are full of emotions. They are suffering. They're in pain. They're in agony. Yes. You cannot convince just simply telling, I reassure you, there is nothing to worry. That is not reassurance. This is what is reassurance. Offering words of comfort and giving advice so that the pain is minimized, the hurt is minimized, the worry is minimized, the agony is brought to the least. How does that sound? So I have given you some 10 points here. Now let me take some opinion from the students. Yes, I'm trying to unmute everyone, but only the name. Yeah. Yes, Dr. Sumant Goyal.
Good evening, sir.
Yeah, good evening, dear. Do you understand what is reassurance now?
Yes, sir.
Now, I'm giving you an offer. I'm giving you an option. You have got all these points. Now, let us see. I am a patient. You suggest me insulin injections. My blood sugar level is not controlled. You're recommending me insulin injections as a doctor. You're a doctor and I'm the patient. Yeah, come on.
So based on the medical history and the current physical examination, and after analyzing each and every minute detail, the best possible suggestion as per the universally recognized standard protocol would be an self-administered insulin injection.
Insulin injections, what are those, doctor? And why do you want to change my treatment plan? I'm not interested. I'm leading a normal life. Everything is going on fine. Only the blood reports, the results, there is something more I feel. But just taking that into account, why are you asking me to change? I'm comfortable this. Sorry, I don't want. I'm not interested. I'm worried. I cannot manage. I'm not a nurse. How can I take an injection all by myself? If something goes wrong, if there are some side effects, how I'm going to face? No, 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 doctor. I don't want.
Your worries are absolutely reasonable. Being a doctor, I can tell something more. This condition is not very severe, and definitely we can manage and bring it back to normal with the use of insulin injections. The only difference between you and a normal individual will be the administration of insulin injection. And I assure you, with the medication compliance, you will be able to live a healthy, normal life like any other healthy individuals in few weeks.
Doctor, you have given me some information. Okay, what if I
Mhm.
so according to your knowledge and what you have told, I yes. Is there no other possible option, doctor? Is this the only? Why don't you suggest me something else? Yes, Dr. Sumant.
Yes, sir.
Yeah. Why don't you recommend something else? I don't want to take these injections. I'm scared. I don't know how to take injections. I'm afraid of injections.
Your worries are absolutely reasonable. I absolutely understand the expressed concerns, which are obviously reasonable. If I were in your place, I would have felt the same. Hearing the word injection makes most people panic. But this is not a very serious or a
Right.
serious situation. It
Okay,
can,
doctor. I understand the importance and the severity of my condition. So you are the right person. So better I follow your suggestions. Thank you very much, doctor. I am ready for that.
thank you so much.
Can you make arrangements for training me? So
Yes, we
this is
can.
the way how we talk. So the way how you are reassuring, the patient should be ready to say, yes, I agree with you. Okay. Yes. Patients will not tell because you are doing something, maybe some interlocutor is telling like that, but patients will not tell very easily. They will be reluctant. They will be reluctant. Then second one will be reluctant patient. That we'll do. So every day we'll take 1 point. Today we have taken what is reassurance. So now you can just grade the session. How beneficial was it for you? Grade the session 0 to 10. If it is the most beneficial, give 10. If it is the least beneficial, give 0. If it is moderately beneficial, give 5. And then, yeah. So, Wrinkle or Mahesh, whoever it is.
Yes, sir.
Yeah, Wrinkle, how was the session? What did you learn from this?
Sir, I have just joined.
Oh my goodness.
I
Okay,
miss person.
no problem. So you can listen to the in the YouTube, then afterwards you can write these sentences which we have given. Okay. And
Okay,
next,
sir.
yeah. So Tasneem Yusuf. Tasneem Yusuf. Can you share your experience? How do you feel regarding this session? Or how far it is beneficial for you?
Yeah, sir, it's absolutely beneficial for me because reassurance, we use this word in our daily period of life, but the true meaning, I just now got it. What is real reassurance mean? So it's really amazing for me and for all of us also. Superb, sir.
Yeah. So many people do not know what is reassurance. That's why struggling to get 350 marks. Struggling to
Exactly,
get
sir.
350 marks. If you can reassure properly, you will get 50 marks. 50 marks, definitely. So try to reassure the patient. You are just saying, no need to worry, don't worry, there is nothing to worry. I reassure you, you will be fine. Is this what it is? Reassurance. So you have to explain the what condition he is in, and that condition is very serious. And many other people also have this condition. So they have taken a wise decision, and doctors has told to take insulin injections. So many other patients also who are in the same condition, they also took insulin injections and they are able to manage the condition and they are leading a normal life. So if I was in his position also, I would have behaved in the same way. But as a medical professional, I know everything. So with my experience, from my experience, I understand what it is that I'm going to explain you. So this is what. So all these things you have to. That is called reassurance. Then at the end they say, how does that sound? Many people learn these 4 sentences. There is nothing to worry. I reassure you, you will be fine. How does that sound? Is this reassurance? Nothing. So careful. Try to make quality sentences. Then welcome to the new students, Bhavani. Hello, Bhavani.
Hi, sir.
Yeah, how was the session? Did you learn anything new?
Yes, sir. Actually, you explained different kind of reassurances. Usually, in clinical setting, there are lot of situations will come like during surgery time, during treatment time, during advice. So there are lot of situations. So in that situations, what the kind of reassurance words we should use, you explained very clearly. So reassurance means it's not only one thing we should advise and compromise the patient which we advised. So the thing which I understand today with your explanation, we should understand their perspective while advising.
That's
That is a
very good.
great thing.
That's very good. Welcome. This is your first session. Okay, actually your classes start from Monday. So today is a orientation session, but it was late, so I could not give. So tomorrow I'll give you the orientation session. And then tomorrow we have a mock test and I will assess your talent. You'll be doing a test. I'll be sending you the materials and you'll be doing the test. And afterwards, we will come to know. And based on the mock test, where you stand, how you are doing, what are your weak areas, what are your strengths, what are your opportunities, and what are your threats. Everything we'll study. And based on that one, we'll start our learning process. So Sunday is a holiday and Monday will be the sessions for these new students. And then Drishti. Hello, Drishti.
Hello, sir.
Yeah, how was the session? Did you attend full session or half only?
No, sir, I I attend a whole session.
Yeah, what did you learn? How was it different from other sessions, or what special impact this session had on you? What is the quality of the sentences? And did you get the clear picture of what is reassurance?
Yes, sir. Actually, I did understand about the actual meaning and deep meaning of the reassurance, and not just superficial sentences which which are given from some classes or getting from some online videos, but it like you teach in a proper way to understand the clear and proper meaning of the reassurance, specifically in perspective of patients, that how to assure patient in a different situation. So I
Right.
get this.
Yeah, that's the end of the session. That's all for now. Simon sir is going for dinner. Good night. Salam alaikum. Shabbat khair. Bye bye. So we'll meet tomorrow for mock test.